Cold abscess, इसका मतलब क्या होता है? The formation of the caseous pus without the signs of inflammation is called as the cold abscess. Why the cold abscess happened? It is because of the liquefaction, and it contains mainly the serum, leukocytes, caseous material, bony debris, and the TB bacilli. Sometimes it can burst and can lead to the formation of the sinus, is what you need to remember. So TB tuberculosis में cold abscess होता है, उसको signs of inflammation are not found, is what you need to remember. Now, what is the process by which the RBCs move out of the vessels through the interendothelial junction? What is that called as? It is called diapedesis. So how do the leukocytes extravasate, doctor? First they undergo margination, they undergo rolling, then adhesion and pavementing, and ultimately they will be transmigrating, which is called as the diapedesis, is what you need to remember. Now in this context you need to know that this adhesion and pavementing, doctor, what are the mediators of it? VCAM1, ECAM1 on the endothelial cells, they induce TNF and interleukin 1, which are the important mediators which you need to remember in terms of pavementing and adhesion, is what you need to remember. Then on the leukocytes there are integrins which are activated by the cytokines, which are very important for the adhesion and pavementing to occur. Then the exudation of the leukocytes. So typically when after the margination there is a rolling, and after that there is a diapedesis, is what you have to remember. Now, in acute inflammation, what are the important vascular changes that occur? There is vasodilation, stasis, increased vascular permeability. They are all the classical vascular changes that occur. So vasodilation will bring more amount of the blood. That's the reason there is a rubor and calor. There is an increased permeability. Because of that, there is a edema that leads to swelling, which is called tumor, and there is a hemoconcentration, stasis of the flow, leukocyte rolling, adhesion, migration. They're all the vascular changes which are important in acute inflammation. Now, doc, who is this great gentleman who has discovered the process of the phagocytosis? अच्छा भाई, आपका जनरल नॉलेज देखेंगे. क्वेश्चन नंबर 7. व्हाट इज योर आंसर, डॉक्टर? रंजित शॉ, अरशद मूसा, हर्षा and many more. Excellent. David Hunter, Suhani Pathak, very good. Ellie Metchnikoff is the one who discovered the process of phagocytosis, which is not a component of Virchow's triad. All of you know that a increased coagulability, diminished blood flow, and a damage to the endothelium, they are the triad of the villains that come together to lead to the development of the thrombosis, is what you need to remember. So cancer is a hypercoagulable condition. Inflammatory diseases, rheumatoid arthritis, SLE, etc., they all increase the coagulability of the blood. Always remember, if you have a breast cancer patient in the ward, if you have forgotten to give the anticoagulation, you are definitely going to get a call from the nurse that she has a dyspnea in the mid of the night, because any cancer, for that matter, is a state of hypercoagulability, and especially when those patients are admitted, you should be quite sure to initiate the prophylactic anticoagulation. Similarly, any chemical irritation or inflammation, vessel wall injury, and the stasis of the blood, immobility, varicose veins, venous obstruction, they're all predisposed to the development of the thrombosis is what you need to remember.